Today's topic is the right ventricle of bovine heart. The right ventricle it forms the anterior border of the heart. It does not reach the apex of the heart and it communicates above with the right atrium through right atrioventricular orifice. The left side of the right ventricle it is slightly raised and it forms a funnel-shaped structure that is known as conus arteriosus, from where the pulmonary artery arises. The right ventricle is triangular in outline. Now coming to the internal structure of the right ventricle. The right ventricle it is lined with a smooth gelatin membrane which is known as the endocardium. Then there are musculotendinous cords. They are known as modulator bands which extends from the lateral wall to the interventricular septum. The size and the number of these modulator bands that generally varies, and it is usually single in the right ventricle. Except in the conus arteriosus, the right ventricle it is lined with muscular ridges. They are known as trabeculae carni. A variety of trabeculae carni, they are in the form of the conical flattened projections which are known as musculi papillaris or papillary muscles. So these papillary muscles they are continuous at the base with the wall of the ventricle, while at their apices they give attachment to the fibrous cords which are known as chordae tendineae. So these chordae tendineae they are attached at the other end with the cusps of atrioventricular valves. So now the right atrioventricular orifice it is large and oval shaped, which is guarded by the tricuspid valve, which is made of three cusps. Each cusp presents two surfaces. One is known as auricular surface and another is known as ventricular surface. The auricular surface is smooth, while as the ventricular surface it is rough and it gives attachment to these fibrous cords which are known as chordae tendineae. The papillary muscles are generally three in number. Two are present on the interventricular septum and one is present on the lateral wall. These papillary muscles they give attachment to these fibrous cords, and these fibrous cords are known as chordae tendineae. They extend up to the cusps of the tricuspid valve. Now there is another opening in the right ventricle that is known as pulmonary orifice. This pulmonary orifice it is circular and it is guarded by the valves. They are known as pulmonary valves. These pulmonary valves they are generally composed of three semilunar cusps. Out of the three, two are anterior. One is among the anterior, one is lateral and another is medial, and another is the posterior. So there are total three semilunar cusps that guards the pulmonary orifice. These semilunar cusps they are very thin and transparent. Each cusp that has two surfaces. One is known as superior surface, which is concave, and the another is known as inferior surface or ventricular surface, which is convex. Each cusp presents two borders. There are two borders present in each cusp. One is known as attached border and the another is known as free border. The attached border it is thick, while as the free border it is thin and concave. So sometimes at the middle of the free border in each cusp there is a fibrocartilaginous thickening that is known as corpus oronti, and a crust or a ridge is present which separates the conus arteriosus and the atrioventricular orifice, which is known as crista supraventricularis. So this is the section of the right ventricle. Here this is the right atrium above, and this is the right ventricle which lies below the right atrium. So here these are the muscular ridges that are present in the right ventricle. They are known as trabeculae carni, and this is the atrioventricular orifice, which is guarded by the tricuspid valve. So there are three cusps present. So this is one cusp and this is the second cusp here. So these cusps, they are attached with these fibrous cords. They are known as cordi tendini. These cordi tendini, they extends from these cusps up to the apices of these papillary muscles. So here these are the flat conical projections among the trabeculae corni. They are known as musculi papillaris. So this is one papillary muscle and this is the another papillary muscle. So these cordi tendini are attached with the papillary muscles, and this is a musculotendinous band that is known as a moderator band. This is a moderator band. So here the left part of this right ventricle, it is forms a funnel shaped structure that is known as conus arteriosus, from where the pulmonary artery arises. So this here in the picture you can see this is the conus arteriosus. This is the opening that is known as pulmonary orifice. This pulmonary orifice, it is guarded by the valves. They are known as pulmonary valves. Pulmonary valves are made of three semilunar valves are there. So these are the three semilunar valves. Anterior, two are anterior and one is the posterior. Among the anterior, this is the medial and this is lateral and this is the posterior. That is the pulmonary valves. So each pulmonary valves, they has the two surfaces. This is known as superior surface, which is concave, and opposite to this surface, that is inferior or ventricular surface, which is convex. And there are two borders attached. One is known as, this is attached border and this is known as free border. So the attached border, it is thick, while as this is the free border. You can see in the diagram, this is the free border of the semilunar valves. This free border, it is concave and it is thin. So sometimes at the middle of this free border, there is a fibrocartilaginous thickening that is known as corpus orandi. So here in the diagram you can see this is the pulmonary orifice, and this is the aortic orifice. So this is aortic orifice. It is also guarded with aortic valve. Three semilunar valves, they are known as aortic valves. But the difference is only these pulmonary valves, they are thin and transparent, while as the aortic valves, they are thick and strong. Thank you.